Hey everyone, welcome back to Speak Healthy. Today, we are going to talk about a fairly new but effective medication in Dupixent that treats those with eczema/atopic dermatitis and other comorbidities. Dupixent is a breakthrough medication that has revolutionized the treatment of eczema, also known as atopic dermatitis. Developed by Regeneron Pharmaceuticals and Sanofi, Dupixent is a biologic medication that specifically targets the underlying causes of eczema, providing effective relief to patients suffering from this chronic skin condition. With its ability to significantly reduce the symptoms of eczema, Dupixent has quickly become the go-to treatment option for both patients and healthcare professionals alike. In this video, we will explore what Dupixent is, how it works, and why it is considered the best way to treat eczema or atopic dermatitis. Number 1. Overview of eczema and atopic dermatitis. Eczema and atopic dermatitis are chronic skin conditions that affect millions of people around the world. Eczema is a general term used to describe a group of skin conditions that cause inflammation, irritation, and itching. Atopic dermatitis is a specific type of eczema that is often hereditary and can be triggered by environmental factors such as allergens or stress. The exact cause of eczema and atopic dermatitis is not fully understood, but it is believed to be a combination of genetic and environmental factors. People with a family history of eczema or other allergic conditions are more likely to develop atopic dermatitis. Other factors that can trigger or worsen the condition include exposure to irritants, changes in temperature or humidity, stress, and certain foods. Eczema and atopic dermatitis are prevalent skin conditions affecting up to 10 to 20% of children and 1 to 3% of adults worldwide. The condition can appear at any age, but it usually starts in childhood, and around 60% of cases develop in the first year of life. Eczema and atopic dermatitis can have a significant impact on a person's quality of life, causing discomfort, embarrassment, and anxiety. Effective treatment options for eczema and atopic dermatitis are essential to manage the symptoms and prevent flare-ups. Traditionally, the condition has been treated with topical corticosteroids and other creams or ointments to reduce inflammation and itching. However, these treatments can have side effects and may not be effective for everyone. Number 2. Traditional treatment methods. Traditional treatment methods for eczema and atopic dermatitis have primarily focused on reducing inflammation and itchiness associated with the condition. The most common treatment options include topical corticosteroids, emollients or moisturizers, and other creams or ointments. Topical corticosteroids are anti-inflammatory medications that can be applied directly to the affected skin. They work by reducing redness, swelling, and itching. However, prolonged use of these medications can cause skin thinning, discoloration, and other side effects. Emollients or moisturizers are another common treatment for eczema and atopic dermatitis. They help to hydrate and soothe dry, itchy skin, reduce the frequency and severity of flare-ups. However, emollients alone may not be enough to manage more severe cases of eczema. Other creams and ointments, such as calcineurin inhibitors, may be prescribed for more severe cases of eczema. These medications work by suppressing the immune response and reduce inflammation. However, they can have side effects such as burning, stinging, and itching. While traditional treatments can provide relief for eczema symptoms, they have some limitations. For example, topical corticosteroids may not be effective for everyone, and prolonged use can cause side effects. Emollients may not be strong enough to manage severe cases of eczema, and other creams and ointments can have side effects. Number 3. The discovery of Dupixent. Dupixent is a biologic medication developed by Regeneron Pharmaceuticals and Sanofi Genzyme for the treatment of eczema and atopic dermatitis. It was approved by the FDA in 2017 and has since become an important new treatment option for people living with the condition. The discovery of Dupixent came about through a better understanding of the role of specific proteins in the immune system that has caused inflammation. Research has shown that two proteins, interleukin 4 and interleukin 13, play a key role in the development and progression of eczema and atopic dermatitis. Dupixent is a biologic medication that works by blocking the action of IL-4 and IL-13 proteins, reducing inflammation and improving the symptoms of eczema and atopic dermatitis. The medication is administered via injection and is given every 2 weeks. Compared to traditional treatments for eczema, Dupixent offers several advantages. Unlike topical corticosteroids and other creams and ointments, Dupixent targets the underlying cause of eczema rather than just the symptoms. This means that it can provide long-lasting relief from symptoms and reduce the frequency and severity of flare-ups. Additionally, Dupixent has been shown to be effective for people who do not respond to traditional treatments or who experience side effects from these treatments. In clinical trials, Dupixent has shown to be effective in reducing the symptoms of eczema in as little as 2 weeks and was well tolerated by patients. While Dupixent is a promising new treatment for eczema and atopic dermatitis, it is not without its limitations. The medication is expensive, and some insurance plans may not cover the cost. Additionally, Dupixent is not recommended for people with a history of allergic reactions to the medications or its ingredients. Number 4. Clinical trials. Clinical trials are an important part of the drug development process, providing researchers and healthcare providers with valuable information about the safety and effectiveness of new medications. Dupixent has undergone several clinical trials to evaluate its effectiveness in treating eczema and atopic dermatitis. In one clinical trial, Dupixent was compared to a placebo in a group of 137 adult patients with moderate to severe eczema. After 16 weeks, patients who received Dupixent had a significant reduction in eczema symptoms compared to those who received the placebo. Specifically, 85% of patients who received Dupixent experienced a 50% or greater improvement in eczema symptoms compared to 35% of patients who received the placebo. Another clinical trial evaluated the effectiveness of Dupixent in a group of 251 children with moderate to severe eczema. After 16 weeks, children who received Dupixent had a significant reduction in eczema symptoms compared to those who received the placebo. Specifically, 39% of children who received Dupixent experienced a 75% or greater improvement in eczema symptoms compared to 12% of children who received the placebo. In addition to these clinical trials, several other studies have evaluated the effectiveness of Dupixent in treating eczema and atopic dermatitis. Overall, the results have been consistently positive, with Dupixent demonstrating significant improvements in eczema symptoms and quality of life for patients. One of the advantages of Dupixent over traditional treatments for eczema is its long-lasting effectiveness. In clinical trials, patients who received Dupixent maintained their improvement in eczema symptoms for up to 2 years. Number 5. How Dupixent works. Dupixent is a biologic medication that works by targeting specific proteins in the immune system that are involved in the development and progression of eczema. The medication blocks the action of interleukin 4 and interleukin 13, which are cytokines that play a key role in the inflammation and itchiness associated with eczema. IL-4 and IL-13 are produced by certain cells in the immune system in response to allergens or other triggers. These cytokines promote inflammation and cause itching, which can lead to the development of eczema symptoms such as redness, swelling, and dry, itchy skin. Dupixent works by binding to a specific receptor called the interleukin 4 receptor alpha subunit, which is found on the surface of certain cells in the immune system. By binding to this receptor, Dupixent prevents IL-4 and IL-13 from binding to the receptor and triggering the inflammatory response. This mechanism of action is different from traditional treatments for eczema, such as corticosteroids and topical creams, which work by reducing inflammation and suppressing the immune response. Dupixent targets the underlying cause of eczema by blocking the action of specific cytokines, which can provide long-lasting relief from symptoms and reduce the frequency and severity of flare-ups. Clinical studies have shown that Dupixent is effective in reducing eczema symptoms such as redness, itching, and inflammation. In addition, the medication has been shown to improve quality of life for patients with eczema, including reducing sleeping disturbances and improving overall mood and well-being. Number 6. Benefits of Dupixent. Dupixent offers several benefits over traditional treatments for eczema, including long-lasting relief. Unlike topical creams and ointments that provide temporary relief from eczema symptoms, Dupixent provides long-lasting relief. Clinical studies have shown that patients who receive Dupixent maintain their improvement in eczema symptoms for up to 2 years. Decreased need for topical steroids. Topical steroids are commonly used to treat eczema, but they can have side effects such as thinning of the skin and increased risk of infection. Dupixent can reduce the need for topical steroids, which can improve overall skin health and reduce the risk of side effects. Improved quality of life. Eczema can have a significant impact on a patient's quality of life, causing discomfort, embarrassment, and sleep disturbance. Dupixent has been shown to improve quality of life for patients with eczema, including reducing sleep disturbance and improving overall mood and well-being. Targeted approach to treatment. Dupixent targets the underlying cause of eczema by blocking the action of specific cytokines that promote inflammation and itching. This targeted approach can provide more effective relief from symptoms and reduce the frequency and severity of flare-ups. Safety profile. Dupixent has a favorable safety profile and is generally well tolerated by patients. The most common side effects of Dupixent include injection site reactions, conjunctivitis, and cold sores. Number 7. Potential side effects. Like all medications, Dupixent can have potential side effects. However, the side effects associated with Dupixent tend to be mild to moderate in severity and are generally well tolerated by patients. Some of the most common side effects of Dupixent include injection site reactions, such as pain, redness, or swelling at the injection site, conjunctivitis or pink eye, and cold sores. In comparison to traditional treatments for eczema, such as corticosteroids and topical creams, the side effects for Dupixent are generally less severe. Topical steroids can cause skin thinning, increased risk of infection, and other side effects, especially with long-term use. Similarly, long-term use of oral steroids can cause significant side effects such as weight gain, mood changes, and increased risk of infection. It is important to note that Dupixent is a newer medication and the long-term safety of the drug is still being studied. However, to date, Dupixent has shown a favorable safety profile in clinical trials. Number 8. The future of eczema treatment. The introduction of Dupixent and other biologic medications has already made a significant impact on the treatment of eczema. With their targeted approach to blocking cytokines that cause inflammation and itchiness, biologic medications have shown promising results in providing long-lasting relief and improving quality of life for patients with moderate to severe eczema. The success of Dupixent and other biologic medications has opened the door for further research and development of new treatments for eczema. Other biologic medications are currently in development, and researchers are also exploring the potential for gene therapy and other novel approaches to treating eczema. The development of these new treatments has the potential to revolutionize the way we approach eczema and other inflammatory skin conditions. By targeting the underlying cause of eczema, these medications can provide more effective relief from symptoms, reduce the need for topical steroids, and improve overall skin health and quality of life for patients. Overall, the future of eczema treatment is looking brighter than ever. With the introduction of biologic medications like Dupixent, researchers and healthcare providers are now able to offer patients with moderate to severe eczema more effective treatment options than ever before. As further research and development continues, we can look forward to even more exciting advancements in the treatment of eczema in the years to come.